Marfan syndrome is an inherited connective tissue disorder with a prevalence of approximately 1 in 5,000. It is caused by mutations in the fibrillin-1 gene. The overall clinical phenotype can be highly variable. However, aortic aneurysms, predominantly involving the aortic root, are highly prevalent, and individuals are more susceptible to both types A and types B aortic dissection. Now, the United States guidelines had recommended that for women with Marfan syndrome contemplating pregnancy, prepartum aortic dimensions greater than 4.0 centimeters would proceed to elective aortic surgery prior to pregnancy. The European guidelines recommended that in women with Marfan syndrome contemplating pregnancy, a prepartum aortic root of greater than 4.5 centimeters should prompt elective aortic intervention. Now, these numbers in the cardiology community are highly distinct. It's like saying someone is 5 foot tall versus 6 foot tall. So we harnessed our large Cornell aortic aneurysm registry, one of the largest single center aneurysm registries internationally, with serial and systematic imaging data. This included a group of very well-characterized Marfan syndrome women by the Ghent Diagnostic Nosologies, whose pregnancies were followed systematically with serial imaging data. Our results demonstrated that women with Marfan syndrome, in whom we have serial and systematic imaging data, demonstrated stability of aortic dimensions throughout the peri-pregnancy period. This included women who had prepartum aortic dimensions between 4 and 4.5 centimeters. There were 5 women in whom we noted peri-pregnancy related aortic complications. 2 women had type A dissection, which both occurred in the 3rd trimester. Both of these women were unaware of their diagnosis of Marfan syndrome prior to pregnancy. There were 2 type B dissections that occurred in the 3rd trimester of pregnancy. Both of these women were aware of their diagnosis of Marfan syndrome prior to pregnancy and had non-surgical aortic dimensions. There was also 1 isolated coronary artery dissection that occurred early in the postpartum period in a woman that was aware of her diagnosis of Marfan syndrome prior to pregnancy. The cumulative incidence of having an aortic dissection was similar in never versus ever pregnant women, and this should be noted. So our results were a rationale to update the 2002 United States Aortic Disease Guidelines for the management of pregnancy in Marfan syndrome. It is now recommended that women with prepartum aortic dimensions of 4.5 centimeters undergo elective aortic surgery prior to pregnancy. The big takeaway from our paper is that type B dissections in Marfan syndrome are unpredictable. This has really paved the way for our latest data, which was published in the Journal of the American College of Cardiology in November of 2023. In which we showed that type B aortic dissection in this patient cohort really represents a more severe phenotype in the setting of longer life expectancy.